Toileting is such an important milestone and one that all parents can't wait for their child to reach. But for the little kids that we see, it is a huge one. Whatever the difficulty is, it's the role of the occupational therapist to break that down. And breaking the task of toileting down into small components is extremely important. It's really complex and it's huge for a little person. So we need to look at each of these individual areas and see what we can do to help support the child on an individual basis. You need to look if you as the parent or caregiver are ready to commit to toilet training. It might be looking at, is the weather right? Is there any changes that are about to occur that's going to make things unpredictable? Because we really need things to be as predictable as possible. Are people well? Are people healthy? Because it's going to take a lot of time and effort for some children to toilet train, and therefore we need to be the best that we can be as the adult in the circumstance. Is the child comfortable on the toilet? No? Well, let's look at what we can do to help. Is the child coping with the toilet paper? No? Again, what strategies can we use in that area? Are they even fearful of entering the toilet room? Well, then what do we need to do to help them feel more comfortable in that certain area? So again, toileting is a huge area and one with multiple different components within it that may need to be broken down into smaller steps. If you have any concerns in regards to your child's toilet training, it might mean that you need to consult with your GP or your paediatrician for further support. They may then refer you on to an occupational therapist who will be able to look at these individualised strategies. At OTFC, we would explore toileting in a holistic way by not only looking at the routines of toileting and some of the strategies that I've already discussed, but also looking at your child's sensory processing and the impact that this may be having on their toileting.